for today's session. And if you have any questions, feel free to leave them in the chat or raise your hand throughout the presentation, but I will let Dr. Wilkinson take it away. Thank you.
Okay, thank you, McKenna. I'm glad to be here for all of you. So, welcome. This is kind of what I'm understanding about the goals for today. So, you had a little blurb about what we were going to do. I want to tell you a little bit about LECOM, and then we're going to be talking about different experiences that you might want to try and do as part of your process of applying to different health professions programs. So my experience is primarily in pharmacy. I'm a pharmacist, but I also teach at a medical school for osteopathic medicine, and I've taught in a few different health professions programs over the years. So, I do want to hear from you guys as we go through. So, as we get started, I'll talk to you about our program and a little bit of background about me. But then the more you can participate and contribute, the more I think interesting it might be for everyone. So, you're invited to turn on your camera if you want to. You don't have to. And then, like she said, using the chat is fine or using Zoom and raising your hand. So I'm trying to get my view set where I won't miss you if you do that. But if you do, I'll pause periodically and look for um, anything that you're trying to tell me. Okay, so a little bit about me just to get started. I'm Julie Wilkinson, and I grew up in Alabama. I went to college right out of high school. I went to Samford University and did the Doctor of Pharmacy degree there. So I signed up as pre-pharmacy. I wasn't too sure what I wanted to do with my career, but I'm very thankful that I got on that path quickly because one good thing about pharmacy is you can do about 2 years of college and then be into the doctor of pharmacy program. So that's what I did, 6 years. And I had that degree, which enabled me to work as a pharmacist. But also, what I chose to do was advanced training in pharmacy. So I went to Idaho. I went to Idaho State University and did a residency. My residency allowed me to work with family practice doctors, and it was two of us pharmacy residents, and then a class of family practice residents of six, either MD or DO out of medical school. And we were taking care of patients in a clinic setting and in the hospital. And so I chose that residency partly for that clinical training, but also because it had a research component related to studying the use of medications in big populations. So I was working with the state Medicaid program and looking at patterns of drug use and doing communications to doctors about their patients with regard to the broader view of their medications. Well, that's why I chose that program, but that also landed me in some academic work. So quickly in the residency, they had me teach students who were in a physician assistant program. And then eventually I was teaching pharmacy students and occupational therapy students. So I really actually found that I enjoyed teaching and I enjoyed the aspects of an academic position. So the cool thing about taking an academic position is you get to do a variety of things as far as teaching, patient care, so still having a clinical practice, and also scholarly work. So that's the path I stayed on. They hired me there to stay on as a faculty member after I finished my training. So I did a total of 4 years in Idaho. Then I went to Savannah, Georgia when they were first starting up a new pharmacy school at South University. And so that was a good experience because I got to learn how to build a pharmacy school from scratch. And then when my husband also became a pharmacist and then he was doing residency training, so we moved to Florida. So I live in Bradenton, Florida, which is over on the Gulf side. If you don't know, it's between Tampa and Sarasota. So I moved here when LECOM first launched the Florida pathway or the Florida campus for the pharmacy school. And I've been here for about 18 years. So that's a little bit about me. And if you have questions about any of that, you're welcome to ask. But it also may come back around when we're talking about the topics for today, as far as how do you even figure out what you want to do? There's a lot of health professions out there that maybe are kind of behind the scenes and you don't even know some of the options that are out there. So we can come back around to it as we're talking. So, a little bit about LECOM. I know we don't want to spend a ton of time on this, but LECOM is based in Erie, Pennsylvania, and it is really fully focused on health professions education. We don't have a full university. So, students come to us for medical school for the osteopathic medicine degree, pharmacy, dental program, and for podiatry. Those are our big health professions. And in Florida, in the Bradenton campus, we have osteopathic medicine, pharmacy, and dental medicine. We're about to launch a campus in Jacksonville. And as of right now, the Jacksonville campus will only have osteopathic medicine, but in the future, it may grow to some of the other health professions. And then we have Erie, which is our main home campus, where our full medical center is also located. So in Erie, LECOM runs a hospital and a geriatric living facility and clinics and other healthcare entities. We also have satellite campuses in Greensburg, Pennsylvania, and Elmira, New York. So some of those campuses are partnered with a university, which is what the Jacksonville will be, where the LECOM Medical School will be on the campus of Jacksonville University. So a lot of different options for you with LECOM. Specifically, I want to tell you about the School of Pharmacy. That's my home. And we offer the pharmacy program here in Bradenton on campus. Students come to class on campus for our 4-year pathway. In Erie, Pennsylvania, we have an accelerated program. So it runs for 3 years, but the breaks are very limited. So the curriculum is the same, but if you do the 4-year pathway, you get some nice summer breaks that are longer. We also offer it through an online pathway. And, for people that already live in Florida, I would like you to come and live in Bradenton and go to our campus. But we actually have a lot of Florida-based students who do take the online pathway. And the way that works is students primarily live at home anywhere throughout the country, but they come to campus for a couple of weeks each year in the summer. So the things that need to be done hands-on are done together when we come in the summer. But also, the way the curriculum works, a lot of it you have to do on your own time, but then we also have a lot of live Zoom sessions every week as you're in that distance ed pathway. So it really meets a need for people who can't physically move. They're already established with their family and they can't move to go to pharmacy school. The distance education pathway allows them to stay at home. One of the things that is going really well with LECOM, and it appeals to all of the different health professions. So any of the DO, dental, pharmacy students, once you've kind of established yourself in your primary medical degree and you're doing well academically, you can choose to add a master's degree. So there are concurrent master's degrees that can be done simultaneously and then finish both at the same commencement. And it's nice because you're not dual enrolled, which means that if you found that something changed, you got overly stressed and you needed to, you can pause the master's degree and just focus on your primary medical program. So some of the masters are in public health, health service administration, ethics, biomedical ethics, I think is going to be a huge one in all the health professions going forward. I personally took the medical education master's program after I joined LECOM as a faculty. That's a great opportunity. We also have a master's in medical cannabinoid therapeutics, integrative medicine, and industry and advocacy. A lot of opportunity exists for people who have the doctor of pharmacy degree to go into jobs with insurance companies and the pharmaceutical industry. So this master's degree might help with just better understanding those options and being competitive for those positions. So, if you don't know, and I am going to ask you guys how many of you are considering pharmacy or what you've learned about it, but within the doctor of pharmacy curriculum, you're going to study all the major disease categories, so chronic diseases especially, and understanding exactly how medications need to be fit into the overall care of the patient. So we do take a really broad approach. It's not just learning the medicines themselves, it's learning the whole patient and the disease process and what are non-drug measures, what are herbals, supplements, vitamins, and of course the over-the-counter and all of the prescription medications, and putting them in the proper perspective based on the best research that's available for treating those patients. So it's very clinically based, but then pharmacy also has its niche areas that are specific to pharmacy that have to do with the actual making of a product, like that we call that whole category pharmaceutics, as far as like why a tablet versus a suspension and what's a suppository, and learning how to make some of the different dosage forms. Also, understanding about how the body handles the medications in the category pharmacokinetics, which is really tailoring the dosing of a medication based on the patient's specific renal function or other aspects of their own physiology, and pharmacogenomics, looking at different genetic markers. So the curriculum is very, very rich. And the curriculum prepares you for a lot of opportunities beyond just what the general public is aware of, where you see a pharmacist working. So finishing the PharmD, yes, you are set to go and work at Publix or other community/retail pharmacies. You're also prepared to work in hospital settings as a pharmacist, but there are a lot of other options, like I mentioned, industry, insurance, regulatory. There are a lot of things, and I'll show you a slide with some of those. I mentioned I did residency after the PharmD. It's not required for practicing as a pharmacist, so it's really nice in that way. But if you do choose to do advanced training, you can become specialized in oncology, psychiatry, all sorts of the medical specialties, but also things like you can do residency training in administration and really become a better expert on the business side of running a pharmacy department in a hospital. So there's a lot of different ways that you can advance your training. I mentioned generally you can be eligible to start pharmacy school after just 2 years of undergraduate work, but there's a specific list of courses, pre-pharmacy courses you have to take, but a degree is not required. And like I said, there are tons of jobs that you may not have considered. So there is a website. This is from a website, Pharmacy is Right for Me. So you can look at that. It's from one of our big industry organizations for all the pharmacy schools, and they have some resources to help you see all the different types of jobs that are out there, to see if there might be something that interests you. The way I view it is, you get the doctor of pharmacy degree, and it's a set body of knowledge that you are learning about drugs and diseases and about medications and how they function in the body, like I talked about earlier. But then once you come to pharmacy school, you spend the last year out in practice. So you do rotations going to different hospitals and pharmacies. And that's where you really can tailor. You can take that knowledge that all pharmacists have, and then you can see where you fit. Like you can try out different environments with different types of patients, different team members, and really come up with what's going to be best for you. Like for me, I ended up based mainly on campus in the classroom, and I really enjoy that. But I've had a couple of friends lately who have gone to take full-time jobs doing medical writing, where their specialized pharmacy knowledge is extremely valuable because they're helping write medical trainings for physicians. So it's working with a company that does CME for doctors. And then as a pharmacist, they're working on that and having a remote work from home job that they really enjoy. So a lot of things that you might have not been aware of. Okay, so that's everything to just kind of set the stage with regard to LECOM and pharmacy careers. And I'm going to transition into today's specific talk, which is about experiences that lead to health professions education. So, is there anything that I mentioned so far that you guys want to comment on or add or question about? Feel free to use the chat too. Is anybody here up? Oh, they are. So I think, I must not be seeing the chat. Let's see. Oh, not yet. Okay. Who here is considering going to be a pharmacist? And is anybody here thinking about that so far? Do you mind telling me? Not yet. Okay. Let me just look at something with you guys. Okay. So let's just go ahead and talk about some of these things. But honestly, I really hope you'll talk with me about them. Okay, so the objectives are there. What I'm aiming to do with you guys over the next 30 minutes is help you consider the choice of activities that would contribute to your professional goals, determine the purpose for choosing certain activities or experiences. And then, you have to have some goals. You have to think about what would be the point of it for you. How do you take steps to find opportunities? I want to help you think about reflecting on experiences to help you move to your next step and then being able to optimize the benefit of those. So let's start with a little scenario. So Kim is 19 years old. She's in college and she believes she would like helping people. And she's been working as a medical assistant at a dermatologist's office. She lives on campus. She's doing well in math and science courses, and she enjoys being involved with her sorority. Okay, so she kind of has two things that she's thinking about doing in her life. So her sorority leaders are asking her to consider running for president next year. She might need to be a little bit older than 19 if she's ready to be president, but and then there's another option, which is there's a pre-health organization that she has been meaning to join that she knows about on campus. Okay, so things I want you guys to sort of think about, and I would like to hear you communicate about, is what are their goals? Like, what do you think are goals that would guide this decision for Kim? How do you think either of these options relates to goals that you think she would have? And then what would be the purpose of choosing each option? So I don't know if you guys are going to help. Let's hear your thoughts. Oh, actually, let me see the chat. Okay. Oh, Brittany's thinking about maybe pharmacy, and Amanda is interested in healthcare. Okay, good. So, what do you guys think about Kim? And what do you think would be some benefits of either of these two options if she's going to pick one or the other, possibly both? Um, what do you think? Will someone unmute and talk about it for a second?
Someone did put something in the chat, which I think is a really good example, bringing up leadership.
Okay, let's see. Delaney, the president position would be good leadership experience for further education. Okay, so great. So pointing out that having some leadership experience, doing things where you have to show leadership, would be valuable. So if her goal is to be accepted into a dental program, then you're thinking that dental programs might want to see leadership, right? And that doing the president role would be a way that you would need to do leadership. Yeah. Okay. Do you think being the president is going to be very time consuming? Yeah, it could take a ton of time. It could be stressful, right? There might be conflict among the different things that the sorority needs to get done. And you, as the president, it's like any organization, all the problems keep going up and up and up. And so anytime you're going up in leadership, you're going to be helping people solve more problems. And so, she has to weigh all of the things she's doing as far as her work, wanting to have good grades, all of those things. But yes, leadership. Okay, what's another thought? What do you think about joining the pre-health um, organization? So you could say a reason why that might be beneficial, or you might think of a reason why that wouldn't be a good use of her time. She's currently working as a medical assistant at a dermatologist's office. So, in some ways, she has a high degree of exposure. She's getting experience in a clinical setting. She's actually working, so holding a job is helping her see what's out there. So she has some pretty high level things when it comes to professionalism and that type of experience. Let's see. The pre-health could help her find volunteer opportunities and research. Oh, that's a great point. Let's see. It would be a good use because maybe she can still learn more tips and tricks. Yep. More connections, possibilities, opening experience, but she already has one good position and it might be a lot on her plate. Depends on the purpose and their person and their time management skills, but it is possible to take on a bigger role while having other responsibilities. Okay, now you guys are getting it. Thank you. These are all the sorts of comments I was hoping you would make. So thank you to everybody. Yes, it's a balancing act, right? And the reason I'm trying to help you work through this is what would be gained and what is the cost, right, for each choice. So with all of this, there's not going to be one right answer, but this is the type of thing that Kim would need to ask herself. So let's keep moving. I have three of these scenarios as well as some other things that we should discuss. So when it comes to goals, right, there are a lot of just goals that are out there that in some ways are influencing all of us all the time. So this was just me kind of thinking through like, what are all the goals at all the levels? So there's like a societal goal. When we join a health profession, it's a trust with society. I know this sounds high-minded, but the thing is that when you get a license from the state of Florida to practice in some medical field, it's because the community is putting a trust in you. They're saying, yes, you've shown that you have enough education, you've made a commitment, and we're going to trust you to be empathetic and competent to serve a role for us. You're in a university, right? And the university has certain goals. They're measured by how well their students do, if their students finish the program, if they pay their bills, pay back their loans, and then they want students to become engaged alumni to help support the university over time. Faculty have goals, right? They want students to be motivated and engaged. Um, the people that we're training you for, right? A lot of people, you have to think about it that yes, we want satisfied students, but we also need to prepare our students for what the employers want. And employers want workers that are dedicated, competent, empathetic. And then you, as a student or the employee, you have your own goals. Like you have certain things you want out of life. You want to be a respected member of society, right? You want to feel satisfaction that you're doing something worthwhile. You may feel a sense of duty that you are gifted in certain ways and you feel responsible to use your talents well to benefit others. You may just want a good paycheck, right? Like there are lots of different goals and values and just factors that are weighing into all of this. And the more when you're making all of these types of decisions, it's good to put it into that big perspective. Okay, so let's talk about Gracia. Okay, Gracia is finishing high school. She was very busy with cheerleading. She plans to live at home and save money while taking undergraduate courses before applying to medical school. A family friend has asked her to work for their medical device company in the office with filing and helping with paperwork. Her favorite restaurant is hiring with the opportunity to become a server after 1 year. So in this case, we're just talking about actual employment. These are jobs that she could choose to do for work. So what do you think about Gracia with her goals? Um, how these two different jobs might relate to her goals, and then what would be the purpose of choosing to work at the medical device company versus at the restaurant. Okay, so there's a positive side with the medical device company. The medical device company is in the field of medicine in some way, right? So they make devices that are on humans in medicine. Okay, but what is the specific job that they are looking to hire her for? They're specifically looking to have her help with filing and paperwork in the office. Any job has the potential of giving you connections. So it is true that working in a medical device company may help her then meet more people who have experience in medicine or who know people who might be involved with medical school. She eventually wants to become a pediatrician, so she wants to apply to medical school. But okay, Nandita, the restaurant may help her with interpersonal skills, right? So you can look and see positives with both of these, okay? Because yes, this is interesting that she has a family friend. She has a personal connection to get into a company that is in some ways related to becoming a pediatrician. And that could help her with her networking and her connections. But it's a job. They're going to have her doing many hours, working in an office, doing filing and paperwork, for which there might not be a lot of benefit. The actual work itself isn't necessarily teaching her anything or letting her practice anything that is very relevant to the work that she wants to do. So you could say that working in the restaurant where you have to deal with the public and you have to work on your communication skills and you have to be able to deal with problems that arise in some ways has some better correlation to the actual things that she would need to do as a healthcare provider. So there's positives on both sides. And all of us can go out and find a restaurant and get hired. Whereas not everybody's going to have like this inside family connection. So that's the other thing that I think it's important to think about this is look at the opportunities that are available to you and then just make the best decision you can with the information you have and just make forward steps. Don't spend your time thinking, well, I wish I had a family friend who had a connection with the company. Just utilize the people, the friends, the family that you have, look around your community, and you just go forth with whatever is available to you, and that you can think about why it would help you meet the goal that you have. Okay, so all of these people that we've been talking about, they want to be admitted into some sort of health profession school, right? So there's a committee that is reviewing applications and thinking about this. So you want to have some things in mind. Like, for example, how do these experiences get communicated to the committee? Like, how do they learn about it? You have it on your resume or your CV, right? You may write about it in the essay or the letter that you write to them, and you might speak about it in the interview. Okay. So as you think about every single one of these, don't just imagine how it looks on your resume. Also think about what are the stories that it will give me to tell, right? So what are the actual scenarios and events that would happen that I would then be able to speak about. And that's where, we said being the president of the sorority would give those leadership opportunities, being able to explain, here's the project that I worked on, and here's how I was able to improve the way we do things in this area. And after I implemented my plan, here's what people said about how it worked better. Having a story to tell about the benefits of what you did in the activity is really more important than just being able to put an item on the resume. That's one thing I really want you to get out of this. The other thing is, how do the experiences add to the committee members' understanding of the candidate? And that gets us back to goals and purpose, right? So, if you choose to do your volunteer work at the animal shelter, and then that is one of your core values is related to the care of animals, and then that really makes that connection of, oh, this person has dedicated many hours of their life to this cause that is important to them. That comes through in the facts of, the resume that shows the range of the years that you spent volunteering in a certain area and things like that. Also, really thinking about what the committee is looking for, right? And trying to put yourself in their shoes. And it's like you want to take the perspective that whatever this profession is leading students to become, you want to trust that the admissions committee is in close alignment with that so that you can think, okay, the important things to function well as a pediatrician are these, and therefore that's what the committee's looking for, right? So the committee wants people that connect well with children or all of those things. So teamwork, leadership, time management, commitments, showing loyalty. So, staying with one company for a longer period of time and getting promotions, right? Like showing that you commit yourself to a place and a group, and then you were able to grow in that opportunity, grow in leadership. So when you think about the different clubs and like organizations that you can join, you want to show that you joined, then within like the next semester or the next year, you showed that you served on a committee. Maybe you were the chair of the committee the following year, and then maybe you eventually ran for office. Growing over time, in some ways, I would argue is better than just being a member of a lot of different committees where you may have had a more superficial um, contribution to those. Okay, one more student scenario. Rick is a first-year college student living at home and working as a pharmacy technician. He plans to apply to pharmacy school next year. His history professor asked him to work as a research assistant for an upcoming scholarly project. His district manager for the pharmacy asked him to transfer to a store that needs help. So he's kind of deciding whether to give more of his energy toward a research project that's in an unrelated field, right? So it's a research project for history versus increasing in his contribution at the pharmacy where he already works and or transferring to a new store with the district manager. So what do you think are some of the pros and cons or just relative benefits between those two choices? This one may seem really slanted toward the pharmacy one, especially after I just talked about growing in leadership, right? Because the opportunity to transfer to a new store that needs his help, that is a really great thing. That's going to look good. That's going to give something to talk about, like we said, because it's an advancement. So I can see where you might feel like it's obviously that one. But I don't know for sure. Let's see what you guys think. Yeah, Brittany. Okay. So you've got the positive, but then you're saying there are some drawbacks potentially, such as a longer commute. And yes, it is a challenge with going to a new store, but it's still more of the same type of work that he's already learned how to do. Okay, Amanda says even if it's a different field, research would teach him about reading scientific papers, understanding charts, and working with a professional. Yes, I agree. So having research experience and the ability to, read challenging material, understand statistical methods of a different projects, um, working on your professional writing skills, your professional communication verbally, all of those might be benefits of doing the research part. Okay, yep. And then lunching, like your point is think about the pharmacy school and how much importance they might put on having scholarly work and research, and that might be a factor to help you decide. Yes, I agree with all of that. Good. Each option could help with collaboration and teamwork if he does both. Yes. So, and I feel like these scenarios that I've been mentioning are the reality. I don't think people have no options. I think they have multiple good options to choose from. And we have to be careful that we don't overextend ourselves. We want to be able to do something well and have some good outcomes come of it so that we can speak about that. We want to be able to have some results. And we want to be able to have time to reflect on what we did and think about how we could have improved. All of those types of things are important. So maybe, one of the harder parts of this is saying no to some opportunities. Okay, how do you decide? We all kind of go through different considerations when we need to make these type of choices. And some of us are more emotional and we just kind of go with our gut, like a feeling. Some of us tend to really prioritize a pro and con list of an analytical mindset. And then that would be the thinking. And then the doing is the idea of some people just jump right into things. Like an opportunity presents itself and they just go for it and they don't really stress about it too much either way. And I would say that all of us have times in our life when we are doing all three, and all three are kind of commingling in themselves. So, for me, I was thinking about becoming a pharmacy student or applying to pharmacy school, and I did some homework a little bit. It was kind of presented to me as something that I might be good at through a survey, and it generally appealed to me. And then I was separately picked my university, and then I found out that they had pharmacy, and I thought, oh, okay, maybe that's making sense on some level. And then I went and shadowed somebody who had worked in a pharmacy. But I really think that the way I ended up going to pharmacy school is mostly about the doing, because I just went ahead and signed up as pre-pharmacy from the beginning. And I got busy with college, and I kind of felt like they kind of just put me on a path, right, to be pre-pharmacy. And then because the university had a pharmacy school, they went ahead and reached out and asked us to interview. And so I felt like, well, if I'm not getting pulled off of this path, right? Like nothing else is drawing my attention. I don't have a problem with this. I think I'm just going to stay on the path. And so, at other times in my life, I've been very analytical. When it came to choosing my residency, I really had a gut feeling. I met the people that I was going to work with because I went to a big conference and met them, and I just liked them. I just felt like they were very smart, and I thought the work they were doing was very cool. And I just thought, oh, this is going to be fun. I can move across the country. So I'm trying to say that it's okay to not always know exactly why you're choosing. I think you're never going to reach a point of absolute certainty, whether that's with your choice of which career path and like which program you go to, or whether that's in these decisions of joining a club or running for president and things like that. So you just need to make the best decision you can in the moment and move forward. Sometimes I think we can bog ourselves down worrying too much about what's the exact right decision when it comes to these different career choices. Okay. Now, the last little segment is kind of just general information. So I don't want to talk too much. I want to give you guys time to speak as well. But, there are a lot of different things you can do. Be creative. That's what the point of this is what what am I interested in, and what's going to move me even just one little step forward toward better understanding what I like, where do I feel comfortable, where do I feel energized, right? Like I'm just interested in this. So any of these things that you can do to just put yourself in different situations, meet more people, it's all going to have a benefit. And then once you do things, it's like, what are you going to do with it? I do think it's good to be thoughtful in curating your own experiences, right? So keeping notes, keeping little lists of the things that you did. So let's say you shadow. Well, while you're shadowing, when you come home, write down what you saw, the people you met, how you felt about it, what you liked, what you didn't like, things that you were curious about. Even if you don't go and research it and solve the things that you were curious about, at least write the question there. Like, why did they do this? What was this about? Get that all down because you will forget. So you want to have a way for yourself to keep notes, keep ideas. And then, definitely having a good resume, thinking about your LinkedIn profile as far as how you want to present yourself to the public in a professional way. And then, our students who are in pharmacy school, I talk to them a lot about when you're out on those rotations and you're taking care of patients and a hard situation comes up. There's a conflict between a nurse and a doctor and a pharmacist, and there's a problem with a patient where we can't get them the medication that they need. And there's a lot that has to go into doing some research and communicating with a lot of people. You need to come home and reflect on that. You need to write it down because those are going to become your stories that you'll tell in an interview, because the interviewers are going to ask you about character traits and they want to hear examples of when you had to use those traits. So, they'll ask you about what was a hard communication situation you were in, or tell us about a time when you had to handle a customer that was angry or upset. So you need to have your stories written down and be able to practice telling about them. So all of these are things that kind of should come out of these experiences. So this list is sort of like the purpose of why you would choose the pre-health club versus some other, like getting a job or doing something else. So all of that are things to weigh about. Internships are kind of their own unique thing. It depends on the field that you're in. But, looking at different opportunities, sometimes you have an opportunity where you could make more money, but it's not very closely linked to your purpose and goal versus doing something that isn't as lucrative in the moment, but is more beneficial for the long term of building your network, meeting new people, getting experiences that you can learn from and grow from. So, for example, people that are interested in the pharmacy world, right? It's great because there are many pharmacies all around town where you can work as a technician, right? So lots of pharmacies can work as a technician. You can work in a hospital in the pharmacy department, but you can also work in the hospital in other departments and still get some exposure to pharmacy. That's helpful. Shadowing pharmacists who work in different settings. For me, I got to shadow someone who worked in a closed door pharmacy. They were making medications that were going to be taken to by home health nurses to the patient for IV medication. So that was an interesting setting that wasn't familiar to me. Pharmacists that do nuclear pharmacy where they're making things that are radioactive. Like there's a lot of really different types of pharmacy jobs that are out there. So just getting a little bit of exposure to some of those is good. A lot of schools offer these little summer camps, like little summer experiences where students can come and kind of get an experience and meet the faculty, see some students. Also, all of these organizations have big conference meetups, right? So they'll have a big convention. You guys are in Orlando, there's everything meets in Orlando. So you can go for a day. You don't have to do a hotel room or anything. You can pay a student rate. And then all of a sudden, you'll be surrounded by people who are practicing in that field. So, pharmacy has several different levels of it. We have an organization dedicated to pharmacists who work in the hospital. We have an entire organization dedicated to people who do the more clinical aspects of pharmacy. So it's people who work in doctors' offices and hospitals and in schools of pharmacy. So different groups will meet and you can go and they'll have programming specifically for students. And you don't have to already be a student in that profession. So lots of different things that people can do. We've already talked about the benefits of a research project as well. So my last little comment is I think alignment may be the key. So finding consistency between yourself and the admission committee members. Like, what is it that they're trying to find as far as students who will be successful in their program and who will be successful practicing in that sort of medical field? And if we can understand that, what is going to make you do well in that program and do well in that field? And then we can trust that the admissions committee is clear about that, then your goal is to try to show them that you've done things that are similar to that. And then you want to be able to tell them about how you did things that are relevant and you enjoyed it, right? So the more you can have more meaningful experiences where you really got involved, you really interacted with patients, you really interacted with people in that field. And obviously no one expects you to have learned everything or be an expert or, already have excelled, but what we love to see is that it was exciting to you. It was motivating to you because if you're motivated, if you understand why you're coming to our program and why you want to be there, then we're confident that you'll be willing to do the work. So that to me is what you want to show that you've done things that are relevant and you enjoyed them. That's my biggest takeaway that I'd like you to get. So what comments, questions, arguments do you have about it?
I had a comment that I wanted to reiterate. I think it was so awesome to hear where you talked about using experiences in different ways. And
Mm-hmm.
I think something that sounds silly, but it was a pivotal moment for me when going to grad school or medical school when I was deciding. I was working at Victoria's Secret in high school. And there was a moment I had where I had an experience where I really learned about equal opportunities and equity. And that was something I was working in retail, but it was such a pivotal moment for me. And I used that interaction experience I had in every interview I had. And it's something that, to reiterate what you said, to be curious, take note of things, even if it wasn't in like a medical setting, for example, or pharmacy setting if you want to go to pharmacy school. But that was really good advice, and I really appreciate you sharing that.
Thank you. I completely agree. Yes, that's linked to, choosing the restaurant job, right? Where it's sometimes that any sort of job or different experience, it's dealing with human people and what they need and thinking about, oh, I'm going into a health professions career. I need to help people. And so there are many different aspects of life where you'll have those experiences. So, yeah, thank you. Okay, what else? Other thoughts? So, who here wants to ask me specifically about pharmacy school or LECOM? Anything on that side? Few people are thinking about pharmacy, I saw. What are requirements for applying to pharmacy school? Okay, let me do something. Let me look. I've got my that slide over here. Okay, so for pharmacy school, I'll show you. These are the prerequisites. I bet you guys already have a lot of them. I'm sharing again. Sorry, I had a little trouble with advancing the slides. I didn't realize it at first. Okay, do you see this?
Yes, thank you.
Okay, so it's general courses, but it does include organic chemistry, physics, calculus. So working on those. We're actively interviewing right now. We do a rolling admission. process. So as students apply and finish their application, we do interviews, and then we accept students quickly after interview if they're eligible. So if anybody's thinking about it for this cycle, you're welcome to reach out. I have the contact info. Let me see somewhere. Here's tuition. Let me give you the contact info. Sorry, I don't want us to go through all of these because they may not all be updated. I'm going to put it in the chat because I didn't see it right there. Well, let me find it. Oh, LECOM doesn't have PA. I mentioned PA. I taught in a PA program when I was in Idaho, actually. And then, the thing that I like about LECOM is if you guys haven't come, we're about 2 hours, and depending on traffic, it may be a little bit more for you to come over. But we have a small campus. We have one big building for the medical and pharmacy. And then we have another big building that is the dental school. And so everybody that's here at this school is in one of those programs. So it's very professional type environment, like it's very safe, and we're in a nice sort of suburban area. The thing about the pharmacy school is we have our faculty on both campuses, but we have a relatively small group of faculty in Florida, and we have a really close-knit group with our students. Everybody gets an advisor, and so you really get to know your faculty. And then the way the curriculum works is we're doing the integrated modules from the beginning. So that means that right from the first semester, you're already doing the full gamut of drugs and diseases and understanding all the aspects of how a pharmacist needs to take care of patients. So you work through disease states gradually, and then later in the years, you start doing complex patients where you integrate across all of the different disease categories because patients are going to have multiple things all at once. And then we're using the team-based learning process. So that means that students study ahead of time and come and take a little quiz, and then faculty work through cases with them. So it's very practical. It's like applying information all the time rather than just being lectured.